Hello, welcome everybody. It's lovely to see everybody starting to join now and starting to come in. So welcome everyone. I am Dr. Vicky Payne. I'm one of the 99 NICU team who are helping to support a 5-part series of webinars aiming to explore the lifelong impact of preterm birth, hopefully through candid conversations with individuals born preterm, experts and advocates. The webinar series is actually a collaboration between the 99 NICU team and the Adult Preemie Advocacy Network, and it's really the Adult Preterm Advocacy Network who have done all the hard work in putting this together. They have organised a host of great speakers, and the webinars will be running all the way through November, as homage really to it being World Prematurity Day in November. So I'm going to shortly disappear off behind the scenes a little bit, but we would love to know who you all are and where you're joining us from. We know that we've had over 100 registrations for the webinar series so far. So please introduce yourself, tell us where you're from, maybe what your role is. Are you an adult born preterm? Are you a parent? We've got a few parents who have joined so far. Are you a neonatal nurse, neonatologist? Let us know who you are. Maybe you work with adults, and that would be interesting as well. So please do let us know where you are and where you're from. The chat is open, so please do put any questions throughout the presentation. Please put them in the chat, and we'll pause throughout to kind of answer any questions that you might have, or answer them also at the end. So please do chat away, and we will moderate that as we go along. All of the webinars are going to be recorded and will be released onto our 99nicu.org YouTube channel, and shared also, I think, on the Adult Preterm Advocacy Network forum as well. So you'll be able to access them after the event. So I think from no further ado, because you don't want to hear any more from me, I'm going to hand over to Lauren Ingledow and Juliette Lee, who are the founders of the Adult Preemie Advocacy Network. And they're here today to share both their stories and their experiences. So over to you. Thank you so much.
Thank you so much for that lovely introduction, Vicky. We really appreciate it. And thank you for all your help with hosting this. So I'm Lauren. I'm 36 years old, and I was born at 26 weeks and weighing 430 grams. My mum had preeclampsia. So my journey into understanding my prematurity actually began at quite an early age. So my mum's background is that she is a retired nurse. So whilst she did not have any of the answers, she, from a common sense perspective, felt that missing that 3rd trimester of my life may mean that I had some challenges growing up. So I had delays in my motor skills, fine motor skills, speech and language, and a lot of the other common areas. And it may sound funny to say that I was aware of this at a young age, but it was really when I got to nursery school where I realised that I was trying to practice things like tying my shoelaces or place building blocks, that my peers around me were noticing that I was a little bit slower, and that the adults in my life were getting frustrated that I wasn't necessarily picking up these things as quickly as perhaps they felt I should. This theme really followed me throughout school. So I had struggles socially with a little bit of bullying. One of my most obvious outcomes of prematurity is vocal cord paralysis. So I always sound like I have a cold or chest infection. And this is again something that from a young age, my peers were picking up on. I had challenges with maths in particular, and also that my teachers couldn't quite understand that I had a reasonably good facility with language, but that this wasn't actually applicable to areas such as maths and science and following patterns. So I think there is a little bit of a feeling that perhaps I was lazy and perhaps not trying hard enough. But with the evidence that has come through more recently, I think we know that this is quite a widespread issue for people born preterm. Health-wise, I didn't really have any particular challenges growing up, just the usual chest infections and colds. But at 26 years old, I became quite unwell, and that took the form of losing muscle mass and feeling chronically fatigued. Blood tests then revealed that I actually had diabetes and chronic kidney disease. And this was where real awareness came to me that specifically within healthcare as well as education, that prematurity really wasn't considered a factor into why these things may be happening. Because when analysing my birth history, there was no record of these kind of issues within my family. So after these challenges, I started to investigate a little bit more into the research, and I was actually quite shocked that there were things like kidney nephron numbers which are dictated by your gestational age and that potentially could have an impact for people born preterm, but that this just really wasn't being communicated to parents, to the patient, or to primary healthcare settings. So from that journey around COVID, I started to look online to see if there were any other people born preterm who would just like to share their experiences, and maybe we had similarities. And that is how I met Juliette. So Juliette, if you would
Thank
like
you.
to
Don't disappear.
Sorry.
Thank you, Lauren. I'm always amazed hearing Lauren's story. Mine is a little bit different. So my name's Juliette. I'm now 27 years old, and I was born at 28 weeks and 4 days gestation alongside my twin sister. We were acutely unwell with twin-to-twin transfusion syndrome, blue lighted to London in utero, and born the next morning via emergency caesarean section as a life-saving measure for all three of us, me, my twin, and my mum. My twin had a very rocky journey, rocky childhood, and did die when we were 12 years old from an acute chest infection after having lots of chronic health concerns throughout her life, and was a very classic complex child, had lots of input from specialists, and I kind of bumbled alongside her. I did require lots of help in NICU, support with breathing, with growing, antibiotics, temperature control, all those sorts of things, nice classic 28-weeker. And then things kind of fizzled out that I seemed to therefore be doing better than my twin, very fortunately. And I was therefore the well twin, the well child, and follow-up finished at 2. And I was kind of left to my own devices. Similarly to Lauren, I had complications with my chest, needed inhalers occasionally, but didn't have any particular diagnoses that stuck with me as I grew up. Went into my infancy and then through into my younger childhood going to school. And similarly to Lauren, I did have some struggles, most notably with mathematics, spelling, and needing support with expressing myself, being able to put my ideas into words, being able to get this onto paper or into a written speech. And that followed me throughout my whole education journey through into university, needing more support at that time. And that was only given to me for mental health concerns through the trauma of losing my twin, rather than maybe recognising some of the language skills and issues that I had, having come from a family that had a very high education attainment level, 4th or 5th generation university student at the time. And I was kind of left a bit floundering and had to find different ways to get help and express things that were difficult to me, not knowing quite who to talk to, how to talk about it. I then, during my childhood, had the pleasure of lots of photographs taken of the time when I was born. My parents were very open with me about my preterm birth. They felt confident with that because it was so, for me, so clearly a part of my journey growing up. It was so important linking into my twins' difficulties. It couldn't be something that was brushed under the carpet. It was very important for them to show me pictures. I would ask why, and they had some answers to give me. And then going into my young adulthood, as my health had started to be a little bit more rocky, I was diagnosed with a nervous system disorder, and this was looked into from a kind of a cardiac, a nervous system and a rheumatology point of view. And my prematurity was dismissed by many of these clinicians, bar one, who actually started to express to me, like with Lauren, missed out on a huge part of that gestation period where the body is growing and learning and forming lots of neurological and nervous system connections, having missed out on that my nervous system can't quite catch up to my peers. I may look fully formed, but some bits just aren't quite connected. I was very grateful to have had that experience with that consultant, but I can see gaps for other clinicians that maybe if they learned a bit more, we might have had a different conversation at a different time and I might have felt maybe more validated. But for me, having pictures growing up and things like that started me on the road to wanting to really know more. I went to university and to train as a nurse. I then had placements in NICU. I felt like I was coming home. It was amazing. I went into these places with all these beeps, bubs, and these babies that were smaller than I was, tiny little babies. And I was excited and intrigued by everything. And my fellow student nurses stood there, you know, jaws gaping, feeling a bit overwhelmed, and I was just buzzing with excitement. But I then chose to access some of my own medical notes and learned a huge amount about my neonatal journey, some of it which my parents didn't know. Apparently I was diagnosed with rickets. No one knew this. How exciting.
I had rickets as well.
Amazing. Oh. And that meant that I started to really know more of the medically things. I was very intrigued, and it meant I could understand a bit more about me. And looking back at how really poorly I was, it makes sense that some things are hard to do. And that led me into exploring online, similarly to Lauren did, and we managed to connect. And from there, we've done a fair bit of work to get where we are today. And I feel so fortunate to have been along for the ride.
Absolutely. So from myself and Juliette meeting each other, we formed a Facebook group which was specifically for adults born preterm, a private group, so we can share our experiences, perhaps in just in an honest way, that perhaps in
Unfiltered.
a way, unfiltered way, in perhaps a way we hadn't been able to discuss openly with our friends or family or acquaintances, and for things that have been misunderstood through school and then leading on into work. So currently we have 291 adults born preterm, and we have been so surprised of how global our network has become, that seemingly adults born preterm across the world are really facing similar challenges, such as birth history not being asked about, acknowledged or understood, challenges with education, challenges with healthcare, and just how prematurity can actually sweep through every domain of your life. So it's not just purely about healthcare. If you're struggling, for example, with energy levels or sleep problems, this will filter into your school life, into your ability to be sociable and make friends, into your mental health, and just how so interconnected all of these things are, and actually there is a potential to really intervene at a much earlier age than we are now, and that really starts at home and with parents. And the better informed our parents are and supported our parents feel, not only through peer support but with professional support as well, that then opens the door for that individual to then be able to advocate for themselves as they become a teenager and a little bit more independent, and then on into adulthood.
And this is something we want to see happen for the current generation, these little beings that are being born today at 25 weeks, that it is the first day of their journey. But we're still here for everyone anywhere in that journey, any family members, any professionals, any individuals born preterm who are with us today, who are in their early adulthood, mid, later, into their golden years, that we want to provide a space that gives them the chance to do those things we really crave, sharing our story, being able to express the things that are hard for us, expressing the things we're really proud of as well. And everyone has a different view on how they feel their prematurity impacts them. There's different researches and clinical information about how it really does, those facts and figures, but also the emotional side, how people are feeling about their identity, how they're feeling about the world around them, the people they interact with, and their relationships with their families and their peers, and how that changes over time, and how we've found people have come to us and have been grateful to be acknowledged and have had the space to go, oh, has anyone else thought of this? Or I was born at this gestation, this is something I'm challenged with. Has anyone else maybe thought of this? And there's always someone to like it, to interact, and to give them a moment to be free to express themselves without it having to be a medical conversation, without it having to be maybe an emotional conversation with their family.
Lovely. So do you run through our aims? What would we
Yes.
like to see?
We've got a crib sheet.
Because we have too many to just reel off.
Yeah. So one of our big aims, as we've already touched on, is providing a global network of peer support. So as we've already seen in the chat, we've got people all over the globe, and sometimes that's a bit overwhelming. We're grateful to have reached lots of little corners, and we want to offer to support to our peers, those born preterm, and support them with advocating for themselves, as we've learned a lot about how do we talk about our health to our own clinicians, and giving that as a suggestion, giving that as support, and encouraging those to advocate for themselves. And this might mean taking a research paper in with them. This might mean coming in with a little note of, okay, what was your gestational age, if you're sure of it, your weight, and what you think your challenge was in NICU, and expressing to the team and working down over time, getting them to understand the implications of the information you're giving them. We're doing a lot of this online, and that helps us be that global centre for adults born preterm. We've got the website, we've got social media groups that provide different spaces. The private space, as Lauren has mentioned, for those born preterm. We thought it was so incredibly important to have a space that is for us, of no matter age now, or whatever gestation you were, whatever circumstances your birth were. If you're born preterm, in you come. We will give you that space and time if that's helpful to you. And then also the channels that support parents and professionals learning more about the insights into our lives. Do you want to do the next one?
Yeah. So next one is to promote awareness and understanding of the lifelong physical and psychological impacts of premature birth. So for this one, I suppose I really want to highlight in a very friendly way that some of this needs to come from neonatology. So if we look at a lot of the research that's going on, a lot of it is really siloed into journals that are relating to neonatology or paediatrics, and there actually isn't that much that I've seen anyway within the adult sphere, and also how this knowledge and increasing understanding is being filtered down onto the ground. So how is this being translated to our primary care providers, to our teachers, to allied healthcare professionals, for example, physiotherapists. So as me and Juliette said, we've both had rickets. We both have hypermobility, which we know has a strong genetic component. But how do these two interplay, and how would that allied professional have the knowledge to be able to support us in this way?
Absolutely. We're wanting to provide resources, either sharing ones already created. We're not going to do double the amount of work, but if something key has been made, or some key bit of research or seminal piece of work has been made, we want to promote and share this, and actually create our own resources, our own webinar series. Thank you, Lauren. And being able to share relevant information within our community, and reaching out to those who have asked for specific questions. Lauren is absolute beast on it when individuals are asking for, has anyone had an issue with their kidneys, and she goes yep. She's just really keen to share her story and is able to pinpoint these kind of wonderful collections of research papers. And this is where this is starting. We're starting to collect together a resource of information on the website under our research papers section, all kind of filtered by different parts and systems in the body, and how this will move on to more peer-produced and co-produced resources that share some of the key points that we're finding within the group that are important for us as we grow, as we develop and go into the world.
So our next aim is to create strong links between the community and researchers to facilitate and advance research into the impacts of prematurity. So we've recently just completed a really interesting piece of work with Shazy Europe, who are looking into the long-term lung health consequences of adults born preterm. And this is a piece of work that is an excellent example of collaboration and co-production, because patients were involved from the start. So we helped to design the questionnaire, design the specific questions that were within the questionnaire, but then also use our forum to be able to share this with the community to ensure that they had plenty of responses and had data that they could actually use.
And it's been good fun. I've been part of some projects that they're completing at the end of this piece of work that's going to be sharing the results and also discussing the importance of being within research, not just reading the research, but being embedded in it and being heard within that research conversation. Part of the information Lauren was sharing about co-producing were these wonderful Zooms, Teams, something, online meetings that was a mix of parents, those born preterm, and the professionals wanting to lead on this research, and everyone shooting ideas off each other, having some conversations about, it was quite clear that our understanding of conversations and questions, was different to parents or people with different backgrounds. I'm quite medically focused, and I really had to reel that in. I was very much going, oh, this makes sense, and other people going, that's a load of medical jargon and gibberish. It doesn't make sense at all. And that taught me a lot about myself, and I found that incredibly valuable. Our next aim is to promote opportunities for others to participate in research. We have a page on the website that links in and is refreshed as best we can into current research projects that are wanting to seek information from and pick our brains of those born preterm, and we aim to advertise on the social media as well, because that's how both Lauren and I kind of really got into it, was thinking about research, and that's what brought about APAN. And it was, how do we get involved in research? And it's grown into something quite a bit bigger, which is fantastic.
And finally, our main aim, I would say, is to promote patient-centred care, including ongoing monitoring, assessments, and healthy lifestyle promotion across the life course. So this is probably our biggest bugbear, is why are we not followed up across the life course? So certainly for me, and I only learned, I'm 36, and I literally only learned this about 6 months ago. So at 3, I had a medical checkup, and I had very naively assumed that whilst this may not incorporate advanced MRI scanning or anything like that, that generally my lungs would be checked, my heart would be checked, all my key areas would have been assessed. I went and asked my mum this question, and she said, no, you had a cardiac check because you had a heart murmur and they just wanted to check that that had cleared up, which it had, which is fantastic. But apart from that, I had no other assessments. And my mum was very clear to me that when she was trying to raise these concerns and worries about the future with primary care, this was leading to queries about her mental health and over anxiety as a parent. And that's definitely something that is almost a self-fulfilling prophecy as an adult. So when we go to our primary care to try and discuss these issues, there's a lot of accusations of health anxiety or hypochondria, and that really our worries are more a mental health issue rather than a reflection of what we have actually experienced as a baby.
And I find those conversations personally incredibly overstimulated, and I can get frustrated and seem tearful when this is misunderstood as a different emotion, whereas in that moment I want to kind of wave some research papers and get them to sit and to listen. And I will, over the years, learn more about presenting my preterm history, and sometimes I will bring my discharge letter from NICU, which is quite a beefy kind of few-sided pieces of A4 paper, and my problems list kind of goes on for half a page, and I still get astounded looking at it, and I'm so grateful to have all my limbs and have 2 eyeballs and things, you know, it's great. But I will come into these appointments, and we've been looking after preterm babies very well, and we are continuing to do that as best as we can in neonatology for centuries, and we're still going, aha, but you would have caught up by 2. Ooh, that was a long time ago. These sorts of phrases are still peppered into some clinicians' assessments, and I think often our birth history isn't, they don't have the knowledge equipped to really understand the implications of the information we're giving them, and therefore the doctor doesn't have things to hand to explain what's going on, and we're not asking for a full explanation or a full assessment of what definitely is going to happen for our health or why everything's happening. But I expect people to be intrigued, to be inquisitive, to ask the question. And when I say, well, born at 28 weeks, this is what happened during my birth, incredibly strained and stressful, this is my NICU journey, I don't want someone to go, oh my goodness, how are you here? I don't need the drama, but we need something that acknowledges that that was a real tricky start to life. And yes, I'm very proud to have done really well, and I was so much weller than my twin. You know, I'm a double-blinded, non-blinded trial. You can compare me to my twin, but I still have things that trouble me, and we all deserve for that to be acknowledged.
Definitely. And without this lack of awareness, it's really closing the doors for conversations across all areas of society. So it's hindering awareness for us long term. It's hindering potential conversations we could have with our parents. So both myself and Juliette are incredibly fortunate that our parents perhaps have medical backgrounds or they are interested in what happened to us. But if I look at that from the other side, from someone where that is not their experience, how are they meant to even begin to navigate these challenges for themselves and for their child?
Absolutely. We know that there is a huge, broad reaching effects of being born preterm, and some of them are very obvious in the NICU, and sometimes a diagnosis will stay with a little one as they're discharged, and this would prompt certain types of care and certain follow-ups because of a particular diagnosis, neurological damage, need for surgery, need for very clear support with very poor eyesight for retinopathy prematurity, gut health for neck, neuro follow-ups for brain bleeds. These have somewhat clear-cut pathways, and children are cared for because they are quite severely symptomatic and need intervention. And then there's the rest of us that are very fortunate to not have some very serious life-threatening diagnoses at discharge. However, we can see a huge broad impact of prematurity, as we've already touched on, affecting our physical health, our mental health, our education, our learning, social interactions, and affecting the whole family unit as well. We have had lots of fantastic conversations within our adult prematurity group that cover the whole span of all of this. And sometimes it's questions and just feedback people want to give us, being appreciative of finding the space, who are wanting to share that they've had a similar story of not knowing much and wanting to know more, or having learned more and being a bit kind of surprised at not knowing this huge thing happened to them at birth, and wanting to talk more about things with their families, but also not having the space within their own communities to do it. So we're providing a bit of a channel so that they can feel welcomed and have some space to talk things through, but acknowledging there are barriers. We have people in the group who maybe have difficulty with English as a first language or difficulty expressing themselves. Sometimes they may be unsure or feel nervous or overwhelmed by coming into a new community. They may have difficulties with hearing or vision, and we aim to be as inclusive as possible, but sometimes do need new ideas, as Lauren and I are very fortunate to have working eyeballs and ears just about, and it's important for us to learn more from our peers who have had different types of journeys, and journeys that have given them those clearer cut outcomes of prematurity where they've needed more medical support and maybe had very, very prolonged periods in hospital, and how that affects their emotional well-being and their memories of this time that's very visceral and has impacted their emotional regulation, and how they manage talking about these times where their families may have always talked about them with quite a lot of emotion and quite a lot of difficulties, and this is something they're wanting to learn how to express themselves and not feel too overwhelmed by it.
As we've touched on sensory processing, is it time to show everybody our wrists?
Well, I've got my hands.
So what you will notice about lots of us is that whilst we wear long sleeves, we tend to roll our sleeves up to our elbows, and we don't quite understand why, but having that sensation of material around our wrists is quite overstimulating and triggering, and sensory processing in the broadest sense is something that comes up within the group really frequently as a topic of conversation.
And there's a few bits that I've always particularly struggled with, and people find it hilarious that I hate touching cotton wool. This is part of my day-to-day job as a nurse when I'm cleaning bits up or taking cannulas out, but actually cotton wool was the only thing apart from medical devices touching my skin for a number of weeks after I was born. Cotton wool, bubble wrap and medical lines, needles, blood sugars, probes for temperature, nasogastric tubes, ties for breathing tubes, that actually my skin's first interactions with the world were these sensations, and I do get laughed at, but it just makes it feel all ew, makes my nails hurt. And I also struggle with things near and around my throat. I had invasive ventilation and also then CPAP and oxygen for a very long period of my NICU stay. And I think when I feel even just a hair or a necklace that's moved up too much, I feel a bit of a choking kind of feeling. And for me, it's very strong. And touching that cotton wool makes me feel like I'm going to shake. And people do laugh at me, going, "Well, that's ridiculous," or not quite understanding it. And I'm like, "Oh, it's just me. Oh, it's just me." But actually, cotton wool go in the bin.
That's such a good point, though, because I think so many people born preterm have sensory issues or perhaps challenges with executive function and other areas, but perhaps they're not quite enough to meet diagnostic criteria and threshold. And whether we actually need prematurity could be something that could be a tick box, and perhaps if we're looking at people born premature, maybe we need to downgrade these diagnostic thresholds to ensure that people are able to get the support that they need.
And it could be the other way, that having been born, if the guidelines and the checklists, you can upgrade, an answer is upgraded because of the fact someone was born preterm. It just depends how things fit in, but acknowledging that as its own risk factor. And this comes up later in the webinar series. You have a fantastic talk with Lauren and a very great colleague of ours. But looking at prematurity as its own risk factor for health complications, that in itself, it's going to boost your risk of different things. This is acknowledged, and how it might make things within the body measure with lower than thresholds, but think our bodies are smaller, they are more immature, our organs came into the world far too early and had to do a lot of strenuous growth in a very difficult environment. NICU is not the womb, and it can't be the womb. That actually our organs just aren't going to play ball, as Lauren found with your blood tests. So yeah. Amazing.
Lovely. So, barriers to advocacy, what challenges are we facing at the moment?
Oh, so there's a lot. I think one of the key ones for me is communicating. You've seen us reel off lots of information, and I'm hoping it's quite clear, but actually going through the process of doing these talks can be really nerve-wracking. It can feel quite exposing, but I can see the value in it. I do enjoy it, but getting words out your mouth can be hard, and getting it to the right ears has taken a long time.
Definitely. So I suppose for this webinar, the one thing I would love to do, if there are any adults born preterm watching, is please come and join me and share your story. We all are unique. We are all individual. We all have amazing journeys, stories, strengths that really need to be highlighted to the wider society. We absolutely do need to acknowledge that we have challenges and issues, but the flip side of that is actually promoting the areas where actually maybe preterm birth has a little bit of a benefit. Maybe it makes us more empathic. What careers are we going into? For example, Juliette is medical. My background is veterinary, working with animals. We have lots of creative people within the group, and just championing some of the good things as well is vital.
It's so important not to forget as well. We've spent half an hour talking about all the things that are hard, and it is such an important reminder. Thank you, Lauren, that our journeys have brought us to this moment to share with others our strength, to share the wonderful creative people that we are. We've overcome a lot, and other people have different opinions on do they feel pride, do they feel proud of themselves, and everyone has a different opinion. I do, I have to say. And remembering that with bringing with us through our lives this journey, every day we're building up more knowledge of ourselves and more knowledge of how prematurity impacts our lives, and we're able to utilize this to help ourselves to learn more and also help others, and passionate about doing it.
Lovely. So I think we'll finish just with the point that every person born preterm and their parents and extended family are so resilient. We are so grateful to our NICU teams that help save our lives. We wouldn't be here without you. So thank you so much. And that this resilience absolutely is ongoing, but just to highlight that we really cannot do it alone.
Yeah. So a big thanks to 99 NICU for the practicalities and welcoming us. Lauren has done just the most immense amount of work to make this happen, and I appeared on the day as a pretty face, but grateful to have this platform. This is something that I think even 2 years ago we wouldn't have thought we
Possible.
could do.
No.
So this is great, and it will be fantastic to see your questions. I don't know if Vicky, had you maybe pinpointed some along the way that we can start with, or should we just work our way through and jab on as much as we can? What would you like us to do?
Oh, what did you say? Just jam on. Yeah.
Yeah,
Just
jam
look at
on.
the chat and jam on. So there are loads and loads and loads. I don't know if you can see them, but there are loads and loads and loads of people sharing who they are, their experiences, but also some questions in the chat as well.
Yeah.
I guess firstly, thank you very much for your candid and open sharing of your stories. I think that there may not be a dry eye on the call. I think there's lots of people in the chat who are you know, really grateful for the work that you're doing. Can you see the chat, or do you want me to pick out some questions for you?
I'm looking through, but I don't know if it's a bit overwhelming. There's a lot there.
Yeah, I can definitely do that.
You can pick them out for us.
Appreciate it.
I'm not reading it all, and it's very heartwarming. But maybe if Vicky can pick out.
I absolutely can. So one of the questions that we've got is from Diane. I hope I'm pronouncing your name right. But Diane has written, coming from the point of view of adults who were born premature and armed with the reflections of your upbringing, what are things that you wish were done by your parents whilst you were growing up that you feel would significantly make an impact? What could parents do differently now to ensure proper support for their children?
Ooh,
Big topic.
Do you mind if I go first? So I just have a few very, very simplistic examples, and there is a backstory. So the first time me and Juliette met in person, apart from saying hello, the one thing we noticed was that we were both wearing slip-on shoes. We weren't wearing laces. So one of the biggest challenges I can remember as a kid is just that unintentional but frustration from my mum wanting to get out of the house, needing to go to work and take me to school, and huffing in the nicest possible way, saying, Lauren, please hurry up and do your shoelaces. Now the truth is, as an adult, I avoid tying shoelaces as much as possible, or I allow time within my schedule to be able to do that. But one of the simplest things parents can do is sometimes take the easy option. Slip-on shoes, Velcro shoes, Velcro. We are a big fan of Velcro. So just any small change that you can make to your child's environment or to the clothes that they're wearing is just so helpful in everybody feeling a little bit calmer and just removing some of that stress from day-to-day life.
Yeah, it means the day-to-day continue. I suppose it's putting on a little hat, pretend you're an occupational therapist and going, this is a task this person, this child is struggling with. How do I make it easier? How do we maybe make it less straining and irritating for everyone? But yeah, the thought, tying shoelaces, ugh, awkward. And I, as a paediatric nurse, I work with a lot of children who have poppers on their baby grows. And I want to throw those baby grows out of the window. There is usually one pairing of colours on the poppers that show you where to kind of on a leg. It's kind of, oh, here you go. This golden one goes on that golden one, and the rest are silver. And I embarrass myself in front of parents poppering up these baby grows, and I've done it wrong. And I'm like, okay, let's unpopper it. Let's leave it to dad. You know, the dad knows more than me. You know, and I've been a paediatric nurse for 6.5 years. So those real fine motor skills and having I don't know if you can see my fingers. Oh no, you can't. You go. Oh no. Okay, it's not going to work. Hypermobility of the fingers and things just poses a real practical challenge. I think with parents, we need to know that parents are being supported through the trauma of this extreme preterm birth. that it will not be planned, it will not be expected, it will not be plain sailing. They will go through times potentially when they're told that their child is failing to thrive. That was a term on my diagnosis as well. And not knowing if they're taking their child home, and then they get home, they're like, oh, what do we do with it now? And then being kind of given reassurances that there we go, look, they're growing, they're maturing, they're meeting those adjusted milestones, and off they go. But maybe they're not. And how do we support parents to be in the position to feel less distressed and being able to, from an early age, express information to their child about their birth? For me, photos is really important. My dad had a really fancy camera for the time. He had a digital camera back in the 90s, and he loved snapping photos, and he took them because they were given the prognosis, and me and my twin, that we weren't going to survive the night. Then it was going to be 3 days, 3 weeks, 3 months. And here I am, 27 years later, still irritating them. Woo! And my dad took a lot of photographs, and that's how I knew about the breathing support I had, and looking at different bits of, oh, that scar, is that cannula in that photo? And, oh, interesting. But my parents they're not medical themselves, but have an interest and an intrigue in medical, had to become medics at home looking after my twin, and they were happy and had the words and had the knowledge to give me information about what they could remember about my birth. And as I started asking questions in childhood, they still had some of it locked away in their memory stores. But I can definitely reflect that quite a lot of families talking about preterm birth, particularly in my situation when there's a loss of a twin or a higher multiple, that it can be very upsetting. And how does a child approach that conversation? That's very challenging, and that needs to be looked into.
Absolutely. And just a general bit of advice for parents is go with your gut. You know your baby, infant better than anyone else. Trust your instinct and keep going.
Yeah.
And only, I suppose, as an adult, I now really appreciate how devastating that must have been for my mum to have her own mental health challenge, when actually her concerns were valid. Even if her worst fears didn't come into fruition, she deserved that space to be able to talk about it openly and feel that support would be ongoing.
Absolutely. And then there's a space for future conversations about how do we make sure this support and this monitoring and long-term assessments of these babies born preterm and us adults born preterm, how do we just make that part of the process and part and parcel of growing up post premature birth, rather than fighting tooth and nail to get information and to get consultations, to get validation, to get checks and confirmation that things are well, or that things do need to be monitored, and having to hit those thresholds.
Thank you. What a great answer. So I think we're in maybe quite a unique position on this call, certainly in the 99 NICU history anyway, to have both almost the patient, the parent, and the healthcare professional all on the call. So we've got a real mix of people. And so one of the questions then I think that follows on from you then, which might be a bit controversial maybe, is are we doing enough then as healthcare professionals? So we've got, for parents on the call as well, are we doing enough in neonatology to start that discussion with parents, or is that even the appropriate time to do it? What do you think? And what do parents think that are on the call?
Yeah, exactly. So no, I don't think we are doing enough, but I appreciate the trauma that parents have been through in NICU, and that discharge probably isn't the right time to start talking about it. But this is where we could start utilising the neurodevelopmental follow-up at 2 and medical follow-up at 3, just to open the door for those conversations. And if follow-up at regular points, and it doesn't necessarily have to be yearly, but just knowing there are these opportunities coming up to speak to a professional, to be able to continue to open the door for conversation about what's going well, but also any concerns parents may have. It flows through then into that individual child's life and sets them up to thrive, and not to be continuing to battle as much as they did in NICU.
Yeah, and to be thriving, not just surviving. And then, as Lauren said, it can start with educating parents at these time points as this child grows, and then switching over some work I did in my professional life is looking at transitional care from childhood, adolescence, adulthood. We then have the opportunity to teach these older children, these young adults, about their health and well-being. We can open those conversations about mental well-being, about conversations about confidence, relationships, information about their longer term well-being, concerns around things like addiction, and these conversations that you need to have with the young person to give them information about their own health and well-being, their risk factors, and a great time for health promotion to talk about lung development, to talk about neurodevelopment, neurodiversity, to discuss lots of things that the person can then be equipped with as much information as possible to make really, well, maybe not good choices, but make their own choices about their future.
It's making informed decisions, isn't it? Every individual will do at the time what feels right for them, but with the right guidance and support, things could definitely be better.
And there's some who has put in the chat, Heather has put in the chat actually, that she thinks that offering family therapy for families of preemies once they're old enough to communicate would be really helpful moving forward. So maybe that's something to for us all to reflect on. There's a couple of, or quite a few things actually relating to documentation and records in the chat. So a few people who are saying they don't even know if their records exist, if they're even still in the basement, I think, is what Heather's written. And Mary has said that actually a lot of people don't have access to the records because they were destroyed. Yes. And Jasmine has put, actually, when from your experience, when you had access to your records, were you supported by a medical professional to answer the questions that you had? She says that they offer that debrief service to parents, but it would be fantastic to facilitate that for adults who have questions around their neonatal stay. And she thinks that she's sure that that would be an eye-opening experience.
Yeah, that would be amazing.
I think I was in the position, I was very fortunate for my records to exist, and they've come to me, some poor soul had to scan 800 pages of records, and some of them have like vitamin liquid drops on them and blood drops, and they are really, really authentic. It's amazing. And I was very fortunate to have been able to access them. But as the commenter said, absolutely lots of these records just have been completely destroyed. There is nothing left. And it's just the memories their parents can pull out from these traumatizing times. And my heart breaks. I find it so intriguing. I've learned so much about my health, and I come from a medical background. I'm trained to really understand the implications of the words on the page and the observations, and when my temperature spiked and when this happened. I've been trained to understand it because I've gone for a 3-year degree at university and worked for 6.5 years as a nurse. But if I hadn't been intrigued, I wouldn't have ever accessed them. They'd be incinerated years ago, I'm sure. So I know that some families, particularly if they've had a very tricky neonatal journey, their siblings or a loss of one of a set, that there's little NICU stories that happen that give you a bit of a diary and things, or children that are going into foster care or adoptive care have a bit of a, this is my early story. And I can see a little place for that if that's kept safe and is then the property of the infant, and it's given to them as a child, as a young adult, and they have a bit of their story that maybe has some of that real medical term and an explanation, does that mean it's less likely to get lost to follow up, as we so often say?
You've just triggered a memory. So I was asked recently at a conference whether it mattered that people knew that they were born preterm, because apparently there are people out there that don't know. And yes, it matters, because it's about connecting that dot. So without that knowledge, I suppose I speak for both of us, but I certainly felt incredibly isolated and alone, having that sense of difference to my full-term peers. But learning about my journey and research and things like that, it's enabled me to connect the dots and accept who I am as an individual, and that is absolutely fine. And that's so important for everybody.
Yeah, we need to know where we've come from, don't we, to understand where we're going also.
Absolutely. I think some people born preterm, their parents go, that's a NICU thing. They're not given the gravity of the situation, how it is a lifelong complication. It's a lifelong thing. It's not going away. It can't go away. And actually, how do they foster an interest for themselves and their child as they grow up to even just care a little bit, to have a little package of knowledge they can pass over to medical professionals that's then reciprocated, that's understood, that's respected, even if they would not want to be doing something like this, if the details of that don't interest them, that's their choice. But it's a very key bit of information. You'll have often in the red book in the UK, we have the red books, which is where it's still, I think they're still doing them routinely, and it's still a little A5 little sideways red book, and it has growth charts and immunisation charts and things. And some families are getting big stickers on the front that say I was born preterm, or I was born at 24 weeks, or something along those lines, with the expectation that in those first few years of life it is quite understood and respected by clinicians. And I think we now need a big sticker on our charts. I know it's all electronic now and I don't know how we go about
We
it.
need a tick box.
Or a big sticker on our face, I don't know, something that goes, we're born preterm. I might not have much information as an individual, Lauren and I luckily do, might not have much information, but it's a really key part of my health history, key part of my story, and needs to be asked about, acknowledged, documented, and then understood. And that's a challenging thing, to get that whole process through.
And I think that signposts over to another one of the webinars in the series, doesn't it, about preterm birth history matters and why it matters. So anyone on the call today that is particularly interested in that, you definitely need to tune in to one of the subsequent webinars for more discussion about that. Going back to the chat, there's a question from Jasmine, who says that she'd be really interested to know about the experiences of women who were born preterm who now access maternity services. So they're now, going to be a parent, and what, if any, extra support are they given? So do you have members in your community, for example, who are going through being pregnant, and do they have any extra support, or do they need extra support?
We have generally asked the question about whether any members have children or not, because there is some research that points to the fact that we may be less likely to have a relationship in the first place, let alone go on to have children. But the answers were really, really mixed. And ladies came back to say that it was a real mixture. Some had gone on to have a preterm child themselves, but some had not, but that this wasn't always acknowledged within maternity care. They weren't always asked the question about whether they had been born preterm themselves. So I think we could do a little bit more there to support people born preterm and ask the question.
Yeah, and our generation, we're kind of probably the loudest voices, I think, at the moment in the adult preterm community, and we're in that age bracket of when women tend to have children, that actually we're now, the generations are coming forward that need this additional care, that need more questions asked and answered for their own kind of maternal, perinatal, whatever it's called, care, as it becomes a much more prevalence within our population as we grow into our middle adulthood.
And there's a couple of people here, I think, who are saying that they do have children. They're an adult born preterm and they do have children. So we'd love to hear maybe more about your experiences, perhaps in a different forum. We have, I guess we're sort of starting to wrap up a little bit now, but please keep the questions coming, because I'm sure that we can answer them in an alternative forum if people have questions. But there is a comment, really, I guess, from Katie, who's a neonatal trainee. She says, hello, neonatal trainee here. Because the specifics of how preterm birth can affect adults is not fully understood and we need more research, it feels hard to talk about this with parents because she feels she has no real answers. And I guess maybe a final kind of wrap-up question or comment might be, if all of us, if you were going to tell all of us on this call what one thing could we do, taking it forward into our day-to-day life or professional practice, what one thing would you want to tell us?
can we say like 5 different things in that sentence, reflecting on what she said at the start, that actually not quite knowing where to begin because not having all those answers is very true today. But saying that you don't know is allowed, that's okay.
Absolutely.
Yeah.
But it's just to be aware and just have a look at long-term impacts, because there is research out there. It may not be conclusive, and we are talking about increased risk factors, not a guarantee, but it's just to be aware.
Thank you. Any
Signpost to us.
Yeah, and signpost to us if you would like research articles. We're happy to send.
So then, one thing that we could all do in our coming weeks and months, either as a parent or as a healthcare professional, what piece of advice, I guess, could you give us to take forward?
That's a big question.
That's a big question.
I suppose if we can answer for each of them, as a healthcare professional, if you're in neonatal care, obviously it's very clear your patients are born preterm. If we are fortunate to have some paediatricians or some adult clinicians here, ask about birth history. And then feel confident to take it on board, even if it doesn't really sing loads of implications to you. Please come to us, come to the communities online and learn more. So asking about birth history. For parents,
I'd go with your gut.
Yeah.
So have that confidence and keep banging that drum, because it probably does feel like bashing your head against a brick wall sometimes, and we empathise with that, and we appreciate you as a parent for fighting as much as you can. But please just keep going as much as you can and seek support where you can, from whether that's peer support services or psychological provision, but just make sure you're looking after yourself so you can then advocate for your child.
And then for our peers here, our adult Preemie community, you are not alone. There is a community for us. As Lauren said, seeing those things that she struggled growing up with and being compared to full-time peers is distressing and can be confusing. And actually, we're a right old mishy-mashy mush of all sorts of different people from all sorts of different backgrounds, with that unifying fact: we were born before we were meant to, and we are happy to talk through everything and anything about life, and to offer a space to talk, validation and guidance of how things might be changed in the future.
A mishy mashy mush sounds like a new social media hashtag, Juliette, that we could start. So I think probably we're coming towards the end of our time now. I hope that everyone who's attended has gained something from it and found it interesting and useful. I'm just sharing some final slides that Lauren and Juliette have asked me to share. Whoop, gosh, it's gone a bit crazy there, hasn't it? Is there anything, Lauren and Juliette, that you would like left to say as final words?
Thank you for watching. We appreciate your support, Vicky and Kat, and to the whole 99 NICU team. And thank you for just everybody's interest in hearing about the work we're doing and hearing about our experiences. And please feel free to get in touch with us to ask any questions or for any comments. And I really hope you have time to watch live or catch up with the rest of the series, because I would love to see everybody there.
And you can reach out to us in any shape or form you like. I think the only thing is you can't send a carrier pigeon, but
no pigeons, no owls,
pigeons and no owls. But there's the website, there's a closed Facebook group for those born preterm. We would love to welcome every person touched by prematurity in their own story to come and join us if you would find it valuable. The Adult Preemie Advocacy Network Facebook group, which is open for all those who are interested, so everyone on this call, if you want to come through on Facebook. We've also got Twitter, and we have the website, which is growing by the day. And then, as Lauren says, please join in with the other webinars. Lauren is leading on those, and I'm very excited for watching the ones that I can come to.
Yeah, thank you very much. So as you can see on your screens, the next webinar is going to be released on the 6th of November. It's a pre-recorded webinar with Mandy Daly, who has done a lot in this field, hasn't she, as a parent? I think she's on this call, so I don't want to mess up. I don't want to mess up her intro in any way. But we've also got one coming up on the 11th of November about preterm birth history and why it matters. We've got one on the 18th of November about the BPD, bronchopulmonary dysplasia collaborative, and insights into long-term preterm lung health. And then on the 27th of November, we've got a webinar about the Periscope project, which is looking at what matters to adults who are born preterm. So hopefully we will see you all again throughout November. Spread the word, share it with people that you know, people outside of the neonatal sphere, for those of us who are neonatal people here. Please share it to your community, pediatricians, people who you work with, GPs. Spread the word. And yeah, we'll see you on the 99 NICU forum in the near future. And thank you everyone very much for joining. And I'll say goodbye now and close the webinar. So thank you very much, everyone.
Thank you.
Thank you, everyone. Take care.